Can pregnant women drink coffee? Let's clear the confusion. Hi, I'm Dr. Ong Zhong Wei, Consultant Obstetrician and Gynecologist in BTMC. In this day and age, most of our working adults cannot live without coffee or cannot perform their daily routine without a morning cup of coffee. But once they are pregnant, their friends and families or their neighbor colleagues will tell them better to stop coffee. But is that true? Let's look at what the evidences tells us. Current research and evidence says that the daily intake of caffeine, as long as not exceeding 200 mg per day, is totally safe in pregnancy. There are certain adverse events associated with caffeine intake, but it is mainly dose dependent and mainly associated with a caffeine intake of more than 200 mg per day. Some people say coffee causes miscarriage. However, based on current evidence and research, it is not associated with your coffee intake, but do note that a high level of caffeine intake per day does associated with smaller baby size, otherwise we call as fetal growth restriction. As long as we are consuming in a moderate amount, daily intake of caffeine does not cause miscarriage. It's worthwhile knowing that if you are used to taking extra shot in any Americano or any coffee beverages that you ordered, what is the difference between when you're pregnant and you're non-pregnant? In normal healthy adults, the caffeine half-life takes about 4 to 6 hours. That means in every 4 to 6 hours, caffeine level reduced by half in your body system. However, when you are pregnant, the half-life can be prolonged until double or triple of the normal timing, which means when you are pregnant, the caffeine actually takes 2 to 3 times longer to be eliminated from your system. Avoiding completely your caffeine intake during your 9 to 10 months of pregnancy journey sometimes is unnecessary. Do consult your doctor if you need further opinion or further advice on what is a recommended intake, and do note that besides coffee beverages, other beverages might have caffeine intake as well. For example, your black tea, green tea, matcha, or even your cola and hot chocolate does contain caffeine content. So do not only be obsessed with your daily intake on how many cups of coffee, but take note on what is the caffeine level, as each beverages impose a different level of content. If you need more advice for a healthy pregnancy, please reach out to us, start taking care of your health and experience your breakthrough with BTMC.